we have Chrissy Upton, Zirconia Aline, Sharon Chilton, Mark Giltner, and absent today because we had to reschedule due to the weather is Kendriana Price. She's not able to be with us today. So please give them a very warm welcome.
Unfortunately, I couldn't be here today due to work obligations on Houston, big teenagers at professional conference. However, I'm really excited for the presentation our group is about to give. I feel strongly for the cause that we're advocating for, and I just hope they do a great job. I had such a good time learning about my agency, and I hope that you guys take on our cause for the 1,000 members. Go group!
70% of Christian County residents have health care insurance. When they're sick, they're able to go to the doctor and receive the treatment they need. Most, if not all of us in this room fall into that 70%. What about the other 30%? What about the working individuals in that 30% whose employers do not offer health care insurance? What about those that cannot afford health care insurance under the Affordable Health Care Act? It's cheaper for them to pay a fine rather than to pay a hefty premium or a steep deductible. Where do they go to get their treatment and prescription medications? Most importantly, who is going to pay for it? This is the reality for 30% of our community. Take a moment and put yourself in their shoes.
That was the cue. I have a long history of acid reflux. I ran out of Nexium before my next shipment will arrive. My medicine from the pharmaceutical company should be here by now, but the holidays have delayed transport. A 7-day supply of this medication would prevent a lot of discomfort and possible damage.
It would be great if there was a way to buy this prescription for the patient to get them through 1 week while they wait for delivery.
I take blood pressure medication. Without it, my blood pressure is high enough to cause a stroke. This is mainly due to the people I work with. Instead of receiving my medicine, I received a letter from the pharmaceutical company telling me that they no longer supply it. This happened on a Thursday, the same day I was supposed to pick it up. Cannot see my doctor at the clinic until Tuesday evening.
If the funding was available, a 5-day supply could be purchased to last until the patient could get the blood pressure prescription changed by his physician and decrease the risk of stroke his employees would cause.
I have COPD. When I get short of breath, I have to use an inhaler. When I realized I was running low, I called the doctor's office to let them know it was time to place a refill order. I was told in order to get my 3-month supply and a new inhaler, I would have to complete a new application. It will take a week to get the application signed by my doctor, and now they're telling me it will be another month before I can have my inhaler at the pharmacy.
It'd be great if there was a place that she could get her inhaler until the application process was complete and the new inhalers were shipped. St. Luke is that place. There's the solution to these real-life scenarios faced by people in our community. St. Luke can continue to be the place these individuals find assistance as long as funding is available through the Pharmaceutical Assistance Program. Exceptional health care can be provided for exceptional people. Isn't everyone in Hopkinsville exceptional?
The idea for St. Luke's Free Clinic began when a homeless man stumbled upon the doors of St. Peter and Paul Catholic Church. There to answer his call were 2 men, Dr. Bill Sweet and the Reverend Gerald Baker. Both men set out on a mission to start a clinic that would help the local uninsured working poor in our community. Their dream came to fruition on May 13, 1993, when St. Luke Free Clinic opened its doors. For 22 years, St. Luke Free Clinic has been the haven for hundreds of people who are uninsured in Christian and Trigg counties. 12, the number of volunteers who take time each week to help those who need medical attention. 110, the number of patients who are currently able to get their medications and see a doctor for free in our community. So who qualifies? Anyone whose income is 200% below the poverty level. Any patient who is in school and 16 years old or up. Anyone who is working yet uninsured, and anyone who is disabled without insurance. Today we'll hear from 2 patients who are currently helped at St. Luke Free Clinic. Please help me welcome Ms. Ana Sanchez.
Good morning, Ms. Anna. Thank you so much for being here with us today and sharing your testimony about St. Luke. Can you tell me how you learned about St. Luke and why you started going there?
Well, I'm a cancer survivor patient, and at one point in time, I found a lump on my other breast. I went to the health department, and they referred me to St. Luke. They did all the testing, and St. Luke referred me to an oncologist, and everything was fine, thank God.
So how long have you been a patient at St. Luke?
More than 3 years, I would say.
And what has St. Luke provided for you in terms of care or prescriptions?
A fantastic care. I don't have to worry about anything as far as my health. I can see the doctor without having to worry about where am I going to get the money to pay for the services. My medicines, they give it to me for free. I mean, everything's been great as far as that. I don't have to worry, and a peace of mind for me.
So what would you have done without St. Luke in your life?
Wow. I don't think I would have probably be here because I cannot afford the care. It's too expensive, even for me that work, but I don't have insurance. I would not be able to afford the medication or to see the doctor. I don't know where I would have gone because I check in everywhere. You have to pay X amount of money just to be seen. Without St. Luke, I don't think I would have had the proper care. My health will not be where it is now. And I don't think I would have been able to survive with all the illness that I have.
Thank goodness for St. Luke.
And yes, thank God for St. Luke and all the people that works there.
Again, I appreciate you volunteering and coming and sharing your story with us today.
Thank you.
We'll hear from Tamela Bell, who is also a patient at St. Luke. Good morning. Thank you for being here.
No problem.
Could you share your story, how you found St. Luke?
Well, I was one of the first patients that ever went to St. Luke's. I went when they was at St. Peter and Paul in '93.
Wow.
And I worked at Bonanza. I was 18. I got a job at 15. And I started working full-time at 18. I caught the flu. And I went there and they treated me for the flu. Then I was diagnosed in '97 with diabetes. So I've been going back ever since '97, and I've been going till now.
And something a little bit special about you, there's some way you help St. Luke. Can you tell me about that?
Yeah, I volunteer anytime they need me for anything. I volunteer. We did trash pickup. We did yard sales. I volunteered stuff at the yard sale. I volunteer to help out at the yard sale.
So can you tell me a little bit about the care that St. Luke has provided for you and the prescriptions?
St. Luke's is my family. I've been going there since '97. They fuss at me when I don't do right. I don't eat right. I love little sweets. They get on me, and they provide excellent care for me. They treat me with the utmost respect. They make me feel like I am somebody. They know my name when I come in. That means more to me than anything. They counsel me. They send me for eye exams due to my diabetes. They've helped me in every way. If it wasn't for St. Luke's, I know I would be dead.
Thank you for your time today.
Thank you.
I worked 12 years as a registered nurse here in Christian County. 5 of those years I spent working in the emergency department at Jenny Stewart Medical Center. So as you can imagine, I have seen and heard just about everything. I do want to tell you one story of a lady that came to the hospital. She was actually there to visit a friend. She was quite fortunate. She hadn't been to a doctor's office or into the hospital in quite some time. So she just felt ignorant to all the technology that she was seeing and the machines that we were using to treat patients. So as we get on the elevator to go up to her friend's room, a young man enters into the elevator with us, pushing this large, bulky, intimidating machine. It had tubes and wires and dials hanging all over it. And as soon as the elevator door shuts, this lady grabs onto one of the tubes. And she said, "My God, I would hate to be hooked up to this thing." And immediately the young man's eyes got real big, and with a smirk on his face, he looked, he said, "Lady, I would too, because this is a floor cleaning machine." We laughed about that hard in this elevator. As you can imagine, she was very embarrassed. But if you've ever been to Jenny Stewart and you've seen the machines that they clean their floors with, I guarantee you'd hate to be hooked up to that machine as well. You see, her idea of technology changed in that moment. But St. Luke's idea of providing exceptional health care for exceptional people has not changed since day one. Our goal here today is to make that care more available to more people. You've just heard 2 personal testimonies from 2 very hard-working ladies of how this clinic has not only changed their lives, but in reality, it's probably saved their lives and countless others. This reality is what makes their objective at St. Luke so important to its patients and to our community, and why our group has concentrated our efforts on helping fund their pharmaceutical assistant program. As mentioned earlier, with a little bit of funding, this program could provide free monthly prescriptions to those working and uninsured. Unfortunately, there are about 40 million Americans that do not have health insurance. They're struggling to manage serious health care issues, but luckily we have St. Luke's in this community that helps fill that void for those struggling. Earlier, you heard 3 scenarios read, and each of these represented the difficult circumstances that one of these patients might face on a monthly basis just to obtain regular prescription medicines. It's a fact, if you do not have a regular doctor or you're uninsured, you're going to have a limited access to prescription medicines. This often leads to unwarranted hospitalizations. It's a downward spiral that ultimately leads to higher health care costs for everyone in this room. You know, this clinic has qualified doctors, pharmacists, nurse practitioners, and nurses and other office staff that volunteer a lot of their time there, and that's great. But their ability to treat these patients is very limited if the patients don't have the medicines that they need. And I think it's important to note, when I mention necessary medicines, I'm not talking about pain medicines or anti-anxiety medicines, the one that people go to the emergency room often seeking. I'm talking about medicines that probably a lot of us in this room are on a daily basis. Medicines for high blood pressure, inhalers for asthma and COPD sufferers, Pepcid or Nexium for the very treatable acid reflux, and the insulin for the diabetics. What you're looking at here is, this shows the progression of a wound on a diabetic's foot. As you can see, and often as they do, they start very minor. But without the medicines on a daily basis to regulate diabetics' blood sugars, this is what they can lead to. There's 2 outcomes for this severity of an injury. They're going to get their foot amputated or they're going to die. This is what St. Luke's Clinic works so hard to avoid. And by being able to place this grant into their pharmaceutical assistant program, it would give this clinic the ability to provide that preventative care that everyone deserves, whether you have insurance or not. You know, it's very rare to have free associated with anything exceptional, but that's exactly what this clinic is doing. I hope by being here today you have a better understanding and appreciation for St. Luke's Free Clinic. I also hope that you recognize what this money would yield in their pharmaceutical assistant program. You know, they accepted the very serious responsibility to preserve human life back in 1993, but they need the necessary resources to carry on that mission today. Thank you so much.
Thank you.